Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance and Minimize Injuries. Welcome to today's episode of Dr. Ozello's Sports Medicine Report. Please feel free to visit my website, championshipchiropractic.com, where you can get additional information on the book and you can connect with me on other social media platforms. Please enjoy this sports medicine video. On today's episode of Dr. Ozello's Sports Medicine Report, I'm going to cover the serratus anterior muscle. Basically, how to stretch the serratus anterior muscle. This is a muscle that is very prominent in boxers, very prominent in bodybuilders. You could see it all the time when you see someone who is a model or see someone who has very low body fat, because these muscles very prominent in those folks. It's nicknamed the boxer's muscle because yes, it is very prominent in boxers. What it does, what its concentric action is basically what is called protraction of the shoulder blade. The shoulder blade is named the scapula in medical terminology. Protraction of the shoulder blade is pulling the shoulder blade away from the spine. So when the serratus anterior muscle works in its concentric form, meaning in its positive form, it pulls the shoulder blade away from the spine. So the opposing muscles are the scapular retractors. Those are the muscles that pull the shoulder blade closer to the spine. So the scapular retractor muscles, those are the ones that oppose the serratus anterior muscle. The serratus anterior muscle, its name, the serratus in Latin means to saw. And I assume that it got that name because the origin of the muscles right here at the ribs sort of looks like the teeth of a saw. So that's probably where it got its name from. Now the muscles, they originate, first of all, they're on both sides. There is a serratus posterior, but we're not going to talk about that today. The serratus anterior muscle originates on the first 8 or 9 ribs. Some folks it originates on 8, some folks it originates on 9, but that's really not that important today, okay? And it runs along the ribs going posterior and superior towards the shoulder blade. Now these little sections where they begin at, they're called branches, or they're nicknamed slips, and they form together and they connect. They go along the ribs, they go in front of the shoulder blade. Like I said, the shoulder blade is called the scapula in medical terminology. They go in front of the shoulder blade and they attach to the medial border of the shoulder blade, meaning that they attach to the inside border close to the spine of the shoulder blade. So that is why their action, okay, when we think of a muscle, we think of when it contracts concentrically. You have to think that its attachment is being pulled towards its origin when the muscle is being contracted in a concentric manner. So the muscle begins here and it ends, I can't even get to it from here, it ends all the way back there. So this motion is occurring. So when we stretch these muscles, obviously you want to do the opposite motion. We want to pull the origin and the attachment of the muscles away from each other. Why is it important to stretch the serratus anterior muscle? You may be asking yourself that. First of all, it's kind of tough to find information on how to stretch this muscle. So I wanted to make this video and let everybody know so I can educate all of you why it's important to stretch this muscle. Obviously, we do all of our stuff in the front, okay? Just through our lifestyles, when we're on a computer, when we're driving, when we're writing, the muscles in the front get used more than the muscles in the back. So we always hear about, oh, the pectoralis minor muscle is tight, the pec muscle is tight, the subscapularis muscle may be tight, even the latissimus dorsi muscle may be tight, and they start to pull us forward. But the serratus anterior can also be tight, and that can pull us forward too. So we want to make sure that we stretch this muscle, that we include stretching the serratus anterior in our stretching routine. This is extremely important. And then also you want to strengthen the muscles of the thoracic spine, the muscles that pull us backwards, the muscles that retract the scapula. So you want to strengthen the rhomboid major, the rhomboid minor, the middle head of the trapezius muscle, and the inferior head of the trapezius muscle. Very important. And you also want to strengthen your rotator cuff muscles. I am going to make a playlist that will include this video, and we'll have other Dr. Ozello sports medicine reports where I explain an exercise called the roll-up that helps to strengthen the thoracic spine, the cervical spine, and the scapular retractors. Also, I'm going to include a video where it is doing pull-up bar scapular retractions, which is an advanced exercise, but it's going to help to strengthen the muscles that retract the scapula, that do the opposite of the serratus anterior. And also the playlist is going to include the reverse pitch, which is an exercise that helps to strengthen the scapular retractors, the posterior deltoid, and the posterior rotator cuff muscles. So you go ahead and watch that when you're done watching this video. If the serratus anterior muscles are tight, it can cause poor posture, it can cause poor shoulder motion, and poor shoulder and spine function. So what happens is these muscles get tight and they start to pull us forward like this. So the person is standing like this. Their thumbs, instead of facing the front, they start to turn inwards, and the shoulders are lifted so that they are forward of where they should be. So it puts us in a bad posture. It's pulling the shoulder blades away from the spine and not allowing our rib cage to function the way that it should, to open up and to breathe. It's not allowing our shoulders and our spine to move the way that they should. So we want to stretch the serratus anterior muscle along with the other muscles in the front of the body, stretch the rib cage muscles and stretch the chest muscles, and strengthen the opposing muscles, strengthen the scapular retractor muscles. Now I'm going to demonstrate how to stretch the serratus anterior muscles several different ways. The technique is always going to be the same. You want to move into a stretch very slowly and hold a mild, comfortable stretch. You are not trained to be a contortionist. You are not training to be a performer where you need to have incredible amounts of flexibility. What you want to do when you stretch, what you want to concentrate on is decreasing muscle tension. The flexibility will come if you continue to do your stretching on a consistent basis. But you want to just think about decreasing the muscle tension and holding a mild, comfortable stretch. You want to move into the stretch slowly, and you hold that stretch for anywhere from 5 seconds to 120 seconds. Now, I know that's a large time frame, but you have to find the amount of time that works best for you. The amount of time that works best for me, personally, is about 30 seconds to about 60 seconds. Some of my patients are different from that. They may do it a little bit shorter, they may do it a little bit longer. You have to figure that out on your own through trial and error. Never perform an exercise that causes symptoms or that elicits symptoms. If you are doing a stretch, if you're doing one of the serratus anterior stretches and you start to feel numbness or tingling in the hands, you want to back away. If you start to feel dizziness, numbness, tingling, you want to stop immediately. If you feel pain deep inside the joint, not that good stretch type of feeling, but pain inside the joint, you want to stop immediately. You can try to modify the stretch. If it doesn't quite work, then just forego that stretch and move on to another one. When we are stretching the serratus anterior muscle, the main thing you want to do is you are pulling the inside, or basically in medical terminology, the medial aspect of the shoulder blade towards the spine. That is stretching pulling the attachment away from the origin of the serratus anterior muscle. Now, that's easy to say, and you could do that. You may feel a little bit of a stretch, but to make it much more effective, you have to have the shoulders and the arms in the optimum position. What I have found through stretching, through attempting this stretch on myself and on my patients, is the best way to stretch the serratus anterior muscle is with the hands, the fingers interlaced behind the head. I'm going to demonstrate this in a seated position, then we're going to do it laying supine, and then on the BOSU Ball, and then on the foam roller. But in the normal seated position, you want to sit up straight. You are going to interlace the fingers behind the head and just gently pull the shoulder blades, bottom corners of the shoulder blades, towards each other. Now you should start to feel a slight stretch in the serratus anterior muscle. That is these muscles right back in through here. Again, they originate on the first 8 ribs, and they wrap around those ribs and attach the inside border of the shoulder blade. Now, you could do this one side at a time, but it works much more effective if you do it bilaterally, or both sides at a time. It's just a simple stretch, a good way to start this stretch. Again, if you feel symptoms or if you feel pain that is not the muscle stretch, then you want to go ahead and stop. And you want to move into any stretch nice and slow and hold a mild, comfortable stretch. You can perform the same stretch laying supine. You could do it on a training table, you could do it on a chiropractic table like I'm on right now. You could do it at the gym laying on a bench. The bench may even be better because it's going to be narrower, and it will allow you a greater stretch. Now, what I like about this position is when you interlace the fingers, you're basically just letting gravity pull your elbows down. You do not want to try to contract those muscles too hard. Just go nice and slow. Once you feel a mild, comfortable stretch in the serratus anterior muscles, hold that stretch for anywhere from 5 to 120 seconds. You can use the BOSU ball to stretch the serratus anterior muscle. You can also use the fit ball. I like to use the BOSU ball better just because the fit ball is higher up, and sometimes it's more difficult for people to maintain their balance. They're more concentrating on keeping their balance than they are on stretching the muscle. With the BOSU ball, obviously you have the flat side down, the round side up. You're always going to have your head supported. If you suffer from any conditions such as vertigo, positional dizziness, low blood pressure, you may want to avoid this stretch. This may be difficult for you. We don't want to bring on any symptoms of dizziness or vertigo. When you are in this position, the head should always be supported. You are going to have your shoulder blades securely on the BOSU ball, and you could do a stretch in a couple different positions. First of all, if you just stretch out to the side, you may feel a little bit of a stretch in the serratus anterior muscle, but most of it's going to be in the pectoralis major. But if you come upwards at an angle, right at the beginning, my arms were abducted to 90 degrees. Now my arms are abducted to about maybe 120, 145 degrees. I start to feel a stretch in the serratus anterior. So right here, this is where I interlace my fingers behind my head, and I start to really feel that stretch in the serratus anterior. So you just let gravity pull the elbows towards the floor, or if you need a little bit of more help, you can always have a partner just push down very, very slightly. Hold this mild, comfortable stretch for anywhere from 5 to 120 seconds. And then you can also stretch just straight overhead if you want to. You can reach as far out if you want to, or just let the arms fall back towards the floor. This is going to help to stretch the serratus anterior muscle. One of the most effective ways to stretch the serratus anterior muscle is with the foam roller. Foam roller, obviously, it's a great tool for decreasing muscle tension, but you could also use it to stretch. When you are laying on the foam roller like I am, when the foam roller is going vertical along the spine, you want to make sure the entire spine is supported. I am laying in the supine position. My sacrum is being supported and my head is being supported. You never want the head to be laying off the roller and the head to be hanging backwards. Very important to make sure that the entire spine is contacting the roller. If you do not have a roller that is as long as this one, you could use one of the shorter ones, say like 24-inch roller, and have a yoga block or anything to support the head. Just you do not want the head falling backwards. Now, when we're stretching the serratus anterior on the foam roller, the same principles apply as when we are stretching on the BOSU ball or when we are stretching on the table. You can have the arms out to the side at 90 degrees from the body, but you will feel more of a stretch in the pectoralis major. So you want to bring the arms up, and as soon as you start to feel that stretch in the serratus anterior muscle, then just breathe out, relax, and let the shoulder blades wrap around the roller, and just let the arms fall towards the floor. Very gradually, let gravity do its job. I can feel a real nice stretch in the serratus anterior muscles right now. You can also do the same stretch, just like we did in the other positions, with the fingers interlaced behind the head, and slowly let the shoulder blades wrap around the roller and the elbows move towards the floor. You may feel in any of these stretches, when we're doing them bilaterally, you may feel more tightness in one side than the other, and that's perfectly normal. Just pay a little bit extra attention to that side. That's all, just a little bit tighter on that side. And then you can move from this position and raise the arms overhead. And you could reach as far as you can. This is going to help to stretch the serratus anterior. It's also going to help to stretch the muscles in the rib cage and the muscles, the pectoralis major muscles on the outside and on the lateral portion of the pec major, the fibers that run more vertical. And then once you have done this one, then just let those shoulder blades, with the shoulders in that same position, but instead of reaching straight overhead, relax a little bit and let the shoulder blades wrap around the roller, and let the arms fall down towards the floor. And you should feel an outstanding stretch in the serratus anterior muscle. This is a very important muscle to stretch. It's often overlooked. The most beneficial time to do slow static stretching, like I described in this video, is after you are done training. The muscles are already filled with blood. They will be able to be stretched a little bit better. When you are warming up, you don't really want to do your slow static stretching. Then you want to do more dynamic motions, bring blood flow to the muscles, get the synovial fluid moving around. Then after you are done training, that is the best time to do your slow static stretching during your cool down. Hold your slow static stretches. It is going to help to decrease muscle tension, and it will help to improve your flexibility. Thank you for viewing today's episode of Dr. Ozello's Sports Medicine Report, where I explain serratus anterior stretching. Please feel free to like this video. Also, please leave any feedback, suggestions, or questions in the comments section below. Please subscribe to my YouTube page. I publish Dr. Ozello's Sports Medicine Report once a week on Thursday mornings. I try to do it in the mornings. And I also publish my other show, 2 Minutes of Anatomy, every Monday and every Friday. In 2 Minutes of Anatomy, I give a 2-minute anatomy lesson. So it'll keep you up on your anatomy. Please visit my website, championshipchiropractic.com, where you can get additional information on my book, Running, Maximize Performance and Minimize Injuries. And also you could connect with me on other social media platforms. My name is Donald Ozello. I am a doctor of chiropractic. My office, Championship Chiropractic, is located in Las Vegas, Nevada. Always remember, train hard, train smart, stay injury-free, and accomplish your goals.